All right, it's that time again to answer your Facebook questions about the coronavirus. And joining us once again is the Lieutenant Governor and the state's COVID-19 liaison, Dr. Josh Green. Good morning, Doc. Ready for the questions?
You bet. Good morning.
All right, first off, Jeff Suda wants to know, in what way is this new variant more transmissible? Experts keep stating it, but never elaborate on the details.
It appears that the shape of the virus is making it more easily infectious. In other words, it's spreading about twice as quickly in South Africa, though they're very poorly vaccinated. We have not seen a surge yet in Hawaii or on the mainland to outstrip the Delta, so it seems that it's being controlled. The challenge is, of course, does it interact with our antibodies from the vaccination? And we haven't got full data on that yet. So the recommendation is keep getting vaccinated, keep stopping the Delta variant from spreading, and we believe that getting the booster shot will protect you from Omicron as well.
Lloyd wants to know, we're taking the family to Disney World for Christmas, but I'm concerned about the Omicron variant and how it could affect our 4-year-old. Should we delay our trip?
I don't think you need to delay your trip. Just be safe. Wear masks, especially that 4-year-old. Put him in a mask or her in a mask, and make sure that when you're around crowds, you don't take extra risks. And the adults should be fully vaccinated and boosted if at all possible. You have to live your lives, and if you've gotten vaccinated, you've done a good thing to keep yourself safer, but we still have masks and socially distancing that can work. Of course, you are taking a little bit of a risk if you're going to be around a big crowd. I don't think you have to cancel that trip.
All right, Melissa wants to know, I live in Eva Beach, and I swear the tap water tastes funny. Will I be getting cancer in 20 years? And what are the side effects of drinking contaminated water?
I certainly hope that that person doesn't get sick ever, or any of our people have a higher risk for cancer. The challenge here is that we do know that fuel has leaked into the water supply from the Navy side. The second shaft had to be shut yesterday. That's the IAEA Navy Alava shaft. This is the circumstance. Hydrocarbons or fuel, when they get in the water, they can cause that smell. They can cause irritation of the mucous membranes, which are like in our mouth, in our stomach, in our eyes. And that can cause us to feel nauseated or sick. Long-term exposure, not short-term exposure, but long-term exposure to fuel like this does run the risk of increasing cancer cases. That's why we're going to have to be very serious about, number one, getting this fuel above ground so we don't have this perpetual concern that our water could be contaminated. I think it is highly likely, and I'll be going to Red Hill today to assess the situation personally and to see families, but it's highly likely we're going to need emergency support from the federal government. I will make that recommendation to the governor in all likelihood that we need some additional support, whether it comes in the form of an emergency declaration or just a lot of extra support from our health department and the Navy remains to be seen. I don't want people to panic, but right now our local water people, this is our Board of Water Supply and Mr. Lau and so on, have done a very good job to keep us safe. But I know that there's concern in the air and we should all be mindful of this.
Let me follow up on that. What if someone does get nauseous from drinking the water? Should they drink more bottled water to try and flush it out or go to the doctor?
If they have a concern at all, definitely err on the side of drinking bottled water. You can also boil your water. As of now, the Navy has told us it's not in the water supply whatsoever for the civilian water sources. But of course, they've asked people to not use the water from their wells. I know that there's a lot of mistrust, and I think that's a healthy mistrust right now because we haven't gotten all the information we deserve. So if you feel that you smell something in your water or you're concerned, yes, use bottled water. And we'll encourage the Department of Health to give constant and thorough updates. Also, we want all of the water in the region sampled in real time so we know whether there's any concern for the public health. It's a very serious situation, Ross, and it's one of those things that though we've had to deal with COVID for 20 months or so, this is a much more acute crisis. And so that's why we'll be a little bit more careful right now. The long game does appear that we'll get water, yes, now in the immediate short term that's clean to all of our people, whether it's bottled water or otherwise. But the long term, we're going to have to bring this oil or this fuel away from the water supply, away from the water table so we don't have these concerns.
Annie has a very similar question. She wants to know, the governor told the Navy to stop operations at Red Hill, but the Navy said they plan to contest that order. Who wins if this goes to court? Because if the feds win, we're the ones here in Hawaii who are left cleaning up their mess.
Yes, so there's going to be a contested hearing where a judge will determine whether the Navy has to follow the order that the governor has issued. If the Navy prevails. If the Navy prevails, then I think it's highly likely that we will need a federal declaration of emergency and need support from FEMA. And I would expect that we will go straight to the president in that circumstance, because let me just say it simply, under no circumstance can we allow petroleum or fuel to be in our water supply, under no circumstance. And it's not just about the safety of the water, although that's the most important thing. It's also about the public confidence that we're all working together. So the contested hearing, which might just be a legal matter, needs to be resolved amicably. The Navy has to work completely hand in hand with the government and the Department of Health here, and we have to move forward together. If not, we will have to have an emergency declaration.
All right, there you have it, the Lieutenant Governor, and of course you'll be heading off to Red Hill later today, so keep us posted on the findings.
I promise.
All right, have a good day, and we'll talk to you later.